Hi everybody, welcome to Wednesday Wisdom. So for today, we are going to be talking about inguinal hernias. And the reason why I am covering inguinal hernias is because I was asked by a lovely patient to cover it today. So that is what I'm going to be talking about. And surprisingly, we do see a lot of these flag up when we do a case history in someone's past history or are under management currently. So I'm going to talk about what it is, how it presents, and what you need to do about it if you're thinking that you might have one. So a hernia as such is a protrusion of contents outside of the abdominal cavity. So we've got lots of different types. We've got umbilical, femoral, inguinal, but the inguinal hernia, which is what we're focusing on today, is a hernia around the groin area. So when the abdominal cavities are coming through a weakness in the abdomen or the abdominal wall. So typically, can be asymptomatic. 66% of people who are suffering with inguinal hernias typically have pain related to this. It's most commonly in men than women, and we'll go over the anatomy in a minute, but it's more commonly in men and women over the age of 40 and can be quite debilitating. It can really impact quality of life, and obviously pain levels as well can stop us from doing stuff that we want to do. So the most common risk factors associated with inguinal hernias, for example, are obesity. So any weight gain around the tummy area that can cause protrusion or form of weakness in the core. Because you think of the bellies protruding out, obviously we've not necessarily got that tight core. Any past history of lower back injuries, for example, where we've weakened the core over time or we've not rebuilt or rehabbed around the area, that can increase the likelihood of weakness around the abdominal wall. Pregnancy, so although women are less likely to get it, pregnancy for women can be a risk factor as well. And anybody in a role where you're doing a lot of lifting or a lot of pressure around the tummy, so any physical work also predisposes, or any gym work also predisposes the likelihood of pressure and pain forming around the groin area. So there are different types of inguinal hernias. The two main types are indirect and direct, and it's all to do with, in terms of the anatomy, it's all related to the position or where they lie around the epigastric vessels, the blood vessels to the abdominal cavity, within the abdominal cavity to the digestive tract. So the direct hernia is the most common in men, and it's when we get a weakness in the fascia of the abdominal wall. So it's all related to the inguinal canal. So what happens to the inguinal canal down in the groin area, its role in the body in men is to carry the spermatic cord, and in women to carry the round ligament of the uterus. So it's all to do with development of the genitalia and obviously development of, in terms of function of that area. So men typically have a wider inguinal canal. What happens with the direct hernias is obviously the inguinal canal is formed by our core muscles, so transverse abdominis, fibers of the internal and external oblique, with the inguinal ligament at the bottom, surrounded by fascia, which is a connective tissue layer bringing everything together. What typically happens is a weakness in the fascia, the transversalis fascia, where we get that pushing out of the contents through a part of the abdominal wall, which is why we can see that bulge coming out. In indirect hernias, it's pushing out of the inguinal ring. So it's all to do with position. But like I said, direct are more common. Typically how they present when they do come on is almost like a palpable bulge around the groin area that you can see slightly lateral, so you can feel almost like pushing the tummy. You can see where it protrudes out and you can always feel like you're pushing it back in. It's worse for anything that increases your intra-abdominal pressure. So coughing, sneezing, bearing down, sitting up, so we're leaning forward, or standing, that increases that pressure through that area, so increase the likelihood of that protruding out. And it's normally better when we're resting. So when we're relaxing and lying back is normally when it's better. And it can be incredibly, incredibly painful. How it's typically diagnosed, you would normally go through the route of the doctor. So you'd normally go through the GP to get this diagnosed. This is on physical examination and palpation, and also your case history. So how it came on, and worse and better for factors and associated symptoms. And the reason why I always recommend getting it assessed if you're thinking that you might have one is one of the key complications of a hernia or an inguinal hernia is strangulation. So where we're twisting and aggravating the blood vessel around that area, so which obviously cuts off the blood supply, which can be really serious. So it's always worth getting it assessed. In terms of a management point of view, Depending on the severity, what they normally look at, if it's quite mild and it's not impacting you day to day, they look at something called watchful waiting, where they continue to check in on your symptoms and see how you're progressing. What they also look at, if it goes to the end where it is very, very severe, what they would look at is obviously surgical repair. And again, lots of different types. The most common that I hear about in clinic when they're coming in is a mesh to fix and almost accommodate for that weakness in the fascia, so adding a mesh into the abdominal wall to fix it there. And so you find that that repairs through the area. Our role as osteopaths, so I feel our position in this is obviously after. So sometimes, you know, we can diagnose by kind of talking to someone and saying and suggesting, you know, go and see your doctor, see what they say. But the role I see after is helping you to regain stability and strength around that area. So once obviously safe and got the all clear from the doctor, it would be through core activation and core strengthening, almost creating that core sort of support very gently to rebuild up your core work. What you would also look at is any compensations that's coming through the body. So you think when we're in pain, we kind of lean over or we twist or we turn because it's sore. What that can do, which is why other pain can flag up, is we might feel it in the lower back if we're changing the position of the tummy and the core and how we hold ourselves, we might feel it higher. So our role is to help with those compensations. So, you know, softening through, getting areas moving, helping you with overall movement through the body and the spine, particularly the lower back if that was a trigger for you or a risk factor, and seeing if we can get you feeling stronger and fitter. So hopefully that was helpful today. Any questions? I absolutely love answering any questions. So please drop them below. Any advice, any, you know, any suggestions of other topics that you want me to cover, just let me know. And like I said before, available on the YouTube channel and the Osteo and Physio Facebook page.